This is your COVID-19 weekly briefing for Friday, April 24th. From the cart to your kitchen, we'll ask the experts about grocery shopping best practices. And your hospital presidents are back, bringing the latest local healthcare updates.
When it comes to workplace safety, what are the do's and don'ts to keep the curve flat? Plus, county leaders highlight new programs helping to feed people and give small businesses some relief. And more patients returning home from the hospital, and in this survivor's case, returning home with a newborn son.
Good morning, everyone. Thank you for joining us live, online, and on air for this COVID-19 weekly briefing. I'm Chris Barrett for the COVID-19 briefing team. Shortly, we'll be joined by healthcare leaders in the Poconos, as well as leaders in both business and nonprofit organizations that are providing tremendous help during these unprecedented times. We want to again thank Blue Ridge Cable TV13, East Stroudsburg University, and everyone helping to provide the public with important information. Please remember, you can get up-to-date information at our website, poconomountains.com/COVID-19. First, an update on the numbers, our week over week as we've been looking from week to week. Now you're seeing on your screens the representation from starting week 4-9 through week 4-23, cases throughout the Pocono Mountains. Unfortunately, fatalities as well. As you can see, we've gained cases over the last 3 weeks, so we still have some work to do. Next slide, please. Giving it by the numbers a little bit more completely, change in cases was a 37% increase from 4-9. Unfortunately, fatalities were a 59% increase. When we look at Monroe County specifically on 4-9, case totals were 70.82%, and now they are at 70.37%. Fatalities were at 64.28, and now they're at 63.63. The Pocono Mountains has, on 4-9, was 5.54% of the case totals. Currently, they are at 4.29. The next slide also takes a look at the increase from 4-9 to the current date in all counties comprising the Pocono Mountains. Right now, we still have some work to do. Next slides. We have also been reporting from the PA Department of Health the age ranges, and you can see from 19 through 65 are comprising most of the cases. Next slide, please. And hospitalizations, age 30 to 80. You can see the corresponding numbers there as well. As it has become our custom, we'll be reporting these every week and possibly adding some more details as we go through. Cases now in Pennsylvania, as per the Department of Health website, and information from them is 37,053. Unfortunately, the fatalities are at 1,003.94. Total negative cases, 142,061. Again, this information can be found at poconomountains.com/COVID-19. Right now, we'd like to bring on set, and he's actually here, is Don from St. Luke's Monroe campus. And Don is going to provide us some updates correct from the front lines. Don.
Welcome and thank you for this opportunity to provide this weekly COVID-19 update. I wanted to first thank our frontline healthcare heroes for their tireless efforts, compassion, and dedication in caring for our patients. I'd like to thank all of our grocery store workers, gas station attendants, and truck drivers who continue to work to ensure that we have access to our basic necessities and have food on our tables. As a community, I am so grateful for all that we have been doing to help flatten and bend the curve. Your support is making a difference. We continue to see positive signs, although we are still caring for a significant number of COVID-19 patients. There have been noticeable decreases in patients being hospitalized and less patients requiring our highest level of care, the intensive care unit. Many of our COVID patients are well enough now to go home. I had the opportunity to celebrate the discharge of one of our patients, Hector Rios, who was a longtime first responder and EMT with Pocono Mountain Regional EMS. He contracted the virus while saving the life of a COVID-positive patient. While hospitalized, Hector's wife gave birth to their son, Victor, at the St. Luke's Anderson campus. Thanks to the extraordinary medical care Hector received and his own personal drive to recover and see his wife and newborn son, he was discharged on April 16th, the day after they went home. I've been using a football analogy for all you sports fans as to where we are in the community in our fight against COVID-19. We as a community have played a good first half, but in order to win the battle against COVID-19, we need to play a good second half. As well, we need to continue to shelter at home, socially distance, and mask when outside the home. Monroe County has one of the highest rates of COVID-19 in the state. The more compliant we are with as a community following these practices, the sooner we will get back to life as normal. I have started to look ahead at what steps need to be taken to get to this new normal in our personal lives, at school, and in our workplace. At this point in time, it is impossible to say exactly when and what our new normal will look like, how long it will last. We need to consider what this new normal will look like. Today, we are going to share some basic steps which can be taken in the workplace to ensure proper social distancing guidelines and being followed within this new normal.
On the outside, St. Luke's Hospital Monroe campus looks much the way it did before the coronavirus pandemic. Inside, patients are the #1 focus, but so too is now the safety of all the employees who work here. Masks, social distancing, and sanitizing work areas are necessary to combat the spread of the virus and keep these men and women able to do their jobs. From the conference room to the break room, the experts say it's critical to take simple steps to save lives. Having a mask is one major way to always protect those around you, not necessarily yourself. Dr. John Brinker explains.
A mask doesn't necessarily protect the person that it's on. It protects the people around that person.
In the case of the conference room at St. Luke's Monroe campus, what used to be able to fit 8 people around the table comfortably now can only handle half that, 4 people, each one 6 feet away from the others.
The closer you are to other people, the more likely this is going to spread. Whether you take all the necessary precautions or not, this is something that you just have to be aware of, that the closer you are, the more likely this can spread.
As Dr. Brinker points out, lunch breaks have to be spent while social distancing from others. The hospital's cafeteria has reminders throughout.
The norms of working in a cubby right next to someone, or sharing or sitting close to your coworkers at lunchtime, or taking a walk over a break and walking right next to each other. This is stuff that we're going to have to reevaluate.
Washing hands, using hand sanitizer, and having the right cleaning supplies to wipe down surfaces will help in the instance germs spread when you aren't wearing a mask, such as being alone in your office or eating lunch.
If you cough and the aerosol lands on a surface, next person comes in, starts to eat their sandwich, now you've got a cross-contamination that could easily be avoided with just some minor care and cleanup.
Finally, staying home when sick is vital to keeping others healthy. Remember, it's not the common cold or flu we're talking about, and following all these measures can make any workplace safer. Wear a mask, maintain social distancing, use proper disinfectants on high-touch surfaces, and stay home when sick. Jim Hamill for the Pocono Television Network.
Dawn, thank you so much. It's wonderful to see a dad and son now home together, and we appreciate you being here. And when I introduced everyone, I should have said we so much appreciate both hospital presidents being here and protecting us in the Poconos and making sure that we're safe and healthy. Thank you both so much. Now I want to welcome Lehigh Valley Hospital President Elizabeth Wise. Thank you, Elizabeth.
Good morning. Thank you to Chris, Don, and also Michael Tekiva and Marlon Kistner for being part of today's program. Through our collective engagement, we demonstrate the impact and community focus of COVID-19 from not only the healthcare perspective, but also as it relates to critical social services and area businesses in providing area support. As some of our new LVHN billboards state, partners, heroes, we're in this together. On the healthcare front, this has been an uplifting week as the number of critical care COVID-19 cases at LVH Pocono has declined, although all other cases remain flat. But what this means is that staying home, social distancing, and public health precautions such as wearing a mask in public are really working. Yet we must all continue on this path to continue flattening the curve. For those of you who tuned in last week, you may have noticed that I displayed a sign of hope. Literally. This was given to me during a time in my life when I was experiencing a very difficult time. And so I share this gift with each of you watching, as together we work through the challenges and triumphs of each day. And at Lehigh Valley Hospital Pocono, as shared last week, there are many triumphs as we learn more about this disease, best practices, including using technology when possible to screen and treat our patients. As of April 20th, there were COVID-19 LVHN video visits over 16,000, e-visits were over 2,300, and COVID-19 calls to my LVHN nurse information line were over 5,100. For more information about how to schedule a virtual visit for COVID-19 concerns or any other healthcare need, please visit lvhn.org. Yet even with these virtual successes, in-person testing and emergency care is not only important, but in many cases it is vital. But understandably, patients can be apprehensive about receiving this needed care. And because of this hesitation, I wanted to share a story with you recently that a community member who entered one of our sites for necessary medical testing. She communicated to me that she was comforted not only by the mindful procedures, which minimized contact with other patients and helped assure her protection, but also the extra touches, such as hand sanitizer, wearing of personal protective equipment by our staff, and warm, friendly staff, which comfort her during these times. Uncertain times. Given that Earth Day was earlier this week, I would like to remind everyone to take the time to safely enjoy the outdoors as a way to stay refreshed and energized. And speaking of safety, and my husband knows I love to shop and I love food shopping, but we have to do it now in a safe way. This next segment highlights how to be safe when purchasing groceries and other necessities as our local Pocono stores, as well as precautions being taken by these critical businesses.
Kinsley's ShopRite in Broadheadsville hired a professional company to disinfect all shopping carts and baskets 3 times a week.
What we have is First Defense, it's Forster's 4080. It's an EPA registered and approved to kill COVID-19, as well as many other viruses, bacteria, and germs.
Like many grocery stores, Kinsley's is taking extra precautions to protect customers and employees, installing plexiglass, regularly sanitizing checkout counters, providing hand sanitizer stations, and adding safe distance floor markers.
We're trying to be, safe and proactive as we can be.
The ShopRite from Home program is a great alternative to traditional shopping. Employees gather orders that customers place online. Customers then have their groceries delivered or pick them up later, curbside delivery style.
Last week we did over 900 orders. 4 or 5 weeks ago we were doing about 400 orders. So we have more than doubled the capacity. We've actually hired probably 25 new associates just for that area.
This month, Lehigh Valley Hospital Pocono is covering all shop from home fees at the Kinsley's location And as of this week, the hospital is covering all shop from home and delivery fees at the Stroudsburg store.
We want to make sure that everyone feels comfortable, stay home. Really just trying to share that message that it is important to limit community spread as much as possible. And we feel as though covering those shopping from home fees are really what is going to help make a big difference.
What about when you get your groceries home?
Bring your groceries up, and then you want to wash your hands immediately prior to putting them away. Put away your groceries and then wash your hands again, and then you want to disinfect the surface that your groceries were sitting on.
Although the risk of transmission from a food item is very low, thoroughly wash fresh fruits and vegetables.
You can put them in a sink full of water with some vinegar, and that will kill all of the germs and fungus that could be on those items.
From the cart to your kitchen, give these precautions a little food for thought. For Pocono Television Network, I'm Brianna Strunk.
Thank you both, Dawn and Elizabeth, from our great health systems, and we indeed have hope. And by their reports every week, we know that they're helping to flatten the curve. They're returning patients home to their loved ones. Most of all, they and their teams are on the front lines, fighting this virus each and every week. We can help them by heeding their advice. You can see both of these stories and more in full on our website at Pocono Television Network and on the Pocono Television Network and channel 734. Now we're going to move to something else before we get to our next guest. Governor Wolf has laid out a plan to reopen Pennsylvania in 3 phases. Right now, the entire state is in the red phase. Red, that means for work and other settings where people come together, it remains life-sustaining businesses open only and schools closed. Large gatherings are not allowed. Bars and restaurants are limited to carry-out and delivery, and the only travel allowed is for life-sustaining reasons. Yellow will ease some of the restrictions, but will continue with safety orders. Large gatherings are still not allowed. Spas, casinos. Green, finally. Green requires all businesses to follow CDC and PA Department of Health guidelines. Same goes for all social gatherings. The governor's office will use multiple data sources, including information from the PA Department of Health, to determine an area's ability to reopen, with the individual benchmarks being fewer than an average of 50 new cases for COVID-19 per 100 individuals each day over a 2-week period. There are many other aspects being considered, and we will report that on subsequent programs and at our microsite at poconomountains.com/COVID-19. Now we'd like to welcome Marlon Kistner, Executive Vice President of the Pocono Chamber of Commerce, and Michael Tekiva, President and CEO of the Pocono Mountains United Way. First, Marlon, questions to you to help our viewers understand how the business community is impacted and how the Chamber is here to help. How is the Chamber supporting our business community during COVID-19?
Well, thank you, Chris. And first, I just want to thank you so much, the Pocono Mountain Visitors Bureau, for all that you're doing to connect our community. I want to thank Elizabeth Wise and Don Seipel. We really look to these leaders to make sure that we're following guidelines, and also just the partnership with Mike Tekiva and the United Way. We are in close contact to make sure that we're all working together. So honestly, Chris, it's been tough. It's been very devastating for the business community, as so many of us know out there. When we're used to growing business and helping businesses and having events, right now we're really in a survival mode. And that's truly what's happening with our small businesses. We do have Chamber staff here. That's the great news, is we are available. We're working really in our homes. We're being safe, but we are absolutely there. We have great social media presence, so it's really important that you check in with us and follow us on social media. That's how we're keeping our people connected. We're doing fun things on social media. Also, we have free virtual events and webinars. These events really help our businesses and our folks come together at a time where we really can't be together in crowds. We have great educational webinars. So it's really important for us to make sure that we are connecting with the business community, giving you different seminars that help you through how do I fund my my office, what do I have to do to get funding, or even just how do I cope through this when there's a lot of really uncertainties. So we're very, very excited to be able to do that. Also, we have been a great connector with our business community and making sure that we're connecting our businesses with our PPI supplies to then go to our hospitals. And that's been working really great. We have amazing businesses that have actually donated over 10,000 pieces so that we can make sure our front lines are safe. We're working closely again with our partners who are here today. We are working on a back to business toolkit. So we understand right now where we are. We may be in the red. We cannot wait to get to yellow and then really get to the green. We understand that and respect that. But when we get to the green, we want to make sure that our businesses are ready and that they have the toolkit, they have what they need so that they can keep their businesses safe, but also their customers safe. And again, we have great resource pages, just as the PMVB does. You're going to see our Lehigh Valley Chamber page, as well as our Pocono Chamber and our Carbon County Chamber page. These are all great resources for you. And again, not just members, this is for the entire business community, and I can't stress that enough. Also, please support your businesses while you can. Those that are doing curbside pickup and takeout, we would love to have you support them because right now that's all they really have. So you're going to find that on our website as well.
So Marlon, how can your staff be reached?
One more thing I want to share, and this is really, really exciting, is right out of the gate, the Lehigh Valley Chamber has been able to give $300,000 in grants to 250 small businesses. And this is grant funding. They do not have to pay it back. This goes to rent. This goes to help pay for supplies and employees. And we're just thrilled that we were able to do that with BB&T and Truist Bank, as well as Jandal and Equinox. So I just cannot thank our chamber members enough for the support that they're giving to our small businesses. And you can contact us. Our information is going to be up on the screen. That is my information, my cell phone number, my email address, and then also our Carbon office as well as our Pocono office. And one last thing, Chris, is we're very excited to be able to provide public policy help during COVID. And you're going to see 3 amazing people that help a lot of our businesses navigate the funding. Where do I click? Where do I start? How do I get unemployment? So we're just thrilled to be here. We're thrilled to make sure that the business community knows that we are here. We are here to help, and we're excited to be able to get us working again. And please, we understand you've got to stay home. We get that. We understand that now, but we want to get you back to work safely, and that's where we're really going to work with our business community and a lot of our leaders. So we really appreciate your support and your help, and we're going to get there.
Thank you, Marlon, so much. It's great to have you on today. I think there's so many good stories with our small businesses in that grant program. So we really want to thank you. Small businesses are really, really hurting right now within the Poconos, and your team they're truly making a difference. So thank you so much.
Thanks, Chris.
Thanks, Marlon. Now to our next guest, Mr. Michael Tekiva, who jumped in right into that action over a month ago and created the Crisis Response Fund through the Pocono Mountains United Way. So far, nearly $180,000 have been raised to help those in need. So, Michael, thank you so much for being with us today. Can you give us some of the facts? What's been happening the past few weeks?
Certainly. Thank you, Chris, and we appreciate the opportunity to share the impact of COVID-19 on our community, as well as to share opportunities for how people can support local efforts. COVID-19 has changed all of our lives. It has been devastating for many, and while we first started to protect our families, we also want to take the time to recognize that there are vulnerable people within our community. They were having a difficult time before the virus. They are continuing to have a difficult time as they miss paychecks, have difficulty paying their rent, have difficulty paying for their food and basic supplies, and United Way cares. We want to deliver the message that we need to be at a position where we are honestly evaluating our community needs, as well as responding, providing a hope, as Elizabeth said, for a better tomorrow and a better normal. The public health crisis really exposes the fragility of our community and our everyday lives. A 2009 study by United Way of Northern New Jersey pointed out a population that was living paycheck to paycheck. They recognized that this population had difficulty paying for their basic expenses, and they named this population ALICE, which stands for Asset Limited, Income Constrained, Employed. Nearly 40% of Pennsylvanians fit into this category of ALICE. This crisis has highlighted the struggles within this population. Janitors, cleaners, grocery store workers, warehouse staff, and many others are considered essential workers. Childcare workers, cashiers, food processing workers, and restaurant staff are among the ALICE population, unable to work from home. They are essential to our society's existence. This crisis should really help us see how essential they are year-round. We've also read reports about the statistical difference between COVID-19 fatality and infection rates between racial groups. Higher fatality rates within Black communities points to the historical disparities, as well as the higher likelihood of existing medical issues, less access to health care, and higher likelihood to work in unstable jobs. At a local level, we will also report that we have seen a 50% increase in food pantry utilization and a 100% increase in the number of people reaching out to 211 and information services. Through this, we have developed a comprehensive website to collect helpful resources to address these and many other issues within our community.
So Michael, beyond the website, how has the United Way responded to COVID-19?
Pocono Mountains United Way believes that this crisis is an opportunity for us to develop a better normal. We are mobilizing resources, both financial and social. We are gathering some of our thought partners to strategize and come up with best practices around food access, housing, sheltering the homeless, long-term community recovery, as well as the summer achievement gap. This past Monday, we had over 100 community representatives meet virtually to address these issues. These calls occur so that we can bring to the forefront some of the best strategies for our community. The United Way has also cataloged all community meals and food pantries. We've also developed a workflow to shelter any homeless individual that may obtain the virus. We continue to explore these best practices to ensure that our community becomes stronger through this crisis. In addition, as Chris mentioned, we've developed a crisis response fund. This idea was to rapidly deploy resources to our nonprofit agencies that have experience and a history of working with vulnerable populations. The Crisis Response Fund is making investment in this area, and over $36,000 has already been released for food pantries, internet access for shelter residents, and assistance to college students that are struggling to continue their education, among several other issues. We've also launched the Community Care Certificate Program. When donations are made to United Way, the organization purchases gift cards from local restaurants and we get them into the hands of local families in need. So far, we've been able to deliver 250 $25 gift cards to local families. This effort is helping both the local restaurants and our local families. We want our local community to do well. Soon we will transition from response to recovery. With most natural disasters, communities come together to physically rebuild. Through this crisis, we're asking the community to come together to build hope and encouragement, to build a system that addresses inequity and the deep-rooted problems, and to become a more culturally competent community, and to build resilience. A better normal will also focus on housing and financial preservation. A better normal will focus on fair pay between men and women, as well as between races. A better normal is a more just society. A better normal will recognize that we are only as strong as our weakest community members. We have the chance to make things better. Pocono Mountains United Way is committed to our community. We will continue to fight for the health, education, and financial stability of every person within our community. The call to action is to join us. It is said that it takes 21 days to develop new habits. I encourage you to develop new habits during this time to strengthen yourself, your family, and your community. Now is the time to decide, how do we want to remember this time? Do we want to remember this time as the time that we helped others, where we focused our energy on positive and healthy choices? Did we focus on building community? Pocono Mountains United Way is here to help you. We need you, and we need all of us to come together to be the solution, to work on these solutions together, and to make a better normal. Thank you.
Michael and Marlon, thank you so much. You both, along with the other leaders in our community, are just incredible. So we want to just thank you for everything that you're doing on a day-to-day basis. Now, let's take a look at some local government updates for 2 of the 4 counties that make up the Pocono Mountains. Last week we heard from the Pike and Carbon County Commissioners. This week Wayne and Monroe counties will give us a look at what's being done to provide relief to those struggling to make ends meet.
I'm John Moyer, I'm Commissioner of Monroe County, and one of the things that I'd like to talk about briefly is the small business loan that we've set up. We've provided funding to the Pocono Mountains Economic Development Corporation, that's Pocono Mountains Economic Development Corporation, to provide loans to small businesses in Monroe County, those between 1 and 20 employees. The amount to be loaned to each company is between $3,000 and $20,000, and the terms are 3 years at 1% with no payments due the first year. Our hope is that this will allow these businesses to stay afloat until this pandemic is behind us and business gets back to a more normal playing field.
Hello, this is Jocelyn Kramer. I am a Wayne County Commissioner, and along with our chairperson, Brian Smith, and Joe Adams, I really want to thank everyone in the community for doing so much to help us mitigate the damage that this virus has done to our community, to help us get back to a reopen sooner rather than later, we hope. And there are so many people that I want to thank. The people that are working in our hospitals that are on the front line of this, that are working in healthcare, the people that are working in our grocery stores, that are pumping your gas, our volunteer fire crews and ambulance drivers. There's so many people in the community that are really doing everything they can to help all of us. I want to thank everybody and encourage them to continue to wear masks when you're out in public, to keep a social distance of 6 feet or more from each other so that we can, again, get back to life a little bit sooner. And I want to thank everybody who has helped any of the volunteer food drive efforts in the community, either through the county program now or through the church. There's an awful lot of people making sure that this virus doesn't do any more damage, and our hearts go out to everybody affected by this virus. We are thinking of you. We thank you. We thank the restaurants for offering takeout and everything that you're doing to keep the public safe. Please hang in there. We will all get through this together, and we can't wait to continue to report on recovery measures when we get there.
Thank you very much to the commissioners, as they are very important partners in our local community. We did hear from the Chamber, we heard from the Pocono Mountains United Way, and we heard from our wonderful healthcare systems. Those leaders and partners within our community, along with all of you, have a great role in flattening the curve and getting us back to recovery. You're watching the COVID-19 weekly briefing here on the campus of East Stroudsburg University, brought to you by the Pocono Television Network, and a special thanks to Ridge CommunicationsTV13 and their crews, and especially Kim Bell, the general manager, and ESU. You can also watch this live streaming on YouTube and afterward on PoconoMountains.com/COVID-19. We'll be back next week with more guests and more important updates for you to keep you and your loved ones safe. As is our commitment, we would like to take a moment to salute all of the frontline heroes who are sacrificing for us day in and day out to keep us all healthy and safe. I'm Chris Barrett. Thanks for watching. Help is just a click away. Visit PoconoMountains.com/COVID-19. That's PoconoMountains.com/COVID-19.